So Nikki's asking whether different brands of testosterone absorb differently. She's been on Testogel, one sachet over 8 days. And she's been on that for months, and she's actually not noticed any improvement in symptoms. I wonder what symptoms, though, she's hoping that might
Mm.
relieve. Is it worth her asking her doctor for a different brand, or is testosterone just not for her?
Either of those is an option. I think we're definitely lacking in research in all areas of women's health, definitely in menopause and even more so in testosterone. So I don't think there's any evidence that one is better than the other. But then women may get on different with different preparations. I think it's important to get a blood test done to check a level and see if that's changed at all. Although again, we're lacking in research about how those levels correlate with symptoms, and definitely give it a bit of time. So if she's been on it for 2 months, it might be it's taking 4 or 5 months, and it's not unusual for it to take that long. And at 6 months, if there's no improvement, then generally we would stop. And unfortunately, I think in the data we do have, it's probably about a third of women it doesn't do anything for. So there is no point being on it if it's not doing anything for you. And also we don't have long-term studies past 2 years to say this is fine to carry on in the long run. So if it's not working. But I think the first thing is probably make sure you've been on it for long enough, make sure you've had a blood test done, and if it's not shifted, maybe think about either reducing, so go to a sachet every 6 days or 7 days. Sometimes I do that. You could go to a pump. I'm less keen on the pump because it goes up and down a little bit more than applying the sachet every day. The Androfen, which is the Australian private brand, is an option, but it does work the same. It's just dosed for women.
Yeah.
So yeah, I think have a conversation with the prescriber and work out the next steps. But it maybe it's not going to work.
And if Chris Nikki was saying that she's generally one sachet of Testogel is lasting about 8 days, that would suggest she's getting the dose reasonably right.
Yeah, that sounds
Yeah.
like she's right. But again, everyone absorbs differently. So some women I have going, a blob of a sachet every other day. Otherwise, they get acne, and they're finding that's all they need to maintain their libido and energy levels. And then other women have shortened the duration. So that first blood test sometimes guides us. Sometimes it's that along with the response to the testosterone in terms of symptoms. So yeah, probably too early to give up completely, and it might
Yeah.
need a bit of a tweak.
And also, I guess back to that point of, don't necessarily listen to Instagram to tell you what testosterone should be doing for you. Be really clear about what it is you are expecting it to
Exactly.
do.
Yes.
Yeah.
Yeah.